Sometimes in our daily life, we can come across those people. Have you ever wondered what happened to them? Did they have some kind of accident? Are they mutant? Maybe they come from a different world. Today we are going to solve the mystery. Who are the CPs? First thing first, what does CP means? It stands for Cerebral Palsy. Second thing to know, what is Cerebral Palsy? Pure, non-progressive, blah blah blah. Okay, let's make it simple. 1. Cerebral palsy is a condition that mostly affects the motor functions. Fact number 2, this is non-progressive. Fact number 3, the disturbance occurs during the fetal life or the first year of life. Fact number 4, it is associated with secondary disorders. Those are the main characteristics of cerebral palsy. Probably it's not very clear at the moment. Let's have a closer look. Before being able to live as an adult, at the beginning of our life, we are babies and we have a fetal life. And this is at this time that our main functions are being elaborated. If anything happens during this time, it is very likely that the function might be impaired for the rest of our life. And this is during this critical time that a disturbance happens to the brain. Now, which disturbance are we talking about? Well, that's the part when it gets a bit tricky. In 75% of cases, the cause is prenatal. That's why it's a bit hard to be sure. So here are some examples of what might happen during the fetal life. One of the first things is the fatal stroke, which might cause a lack of blood supply to the developing brain. Of course, infections to the mother or the fetus. Another thing that might happen is a lack of oxygen provided by the placenta. Exposure to radiation is also a threat to the brain. And in some cases, we also know that genetic, causing the brain not to develop normally, can be a cause of cerebral palsy. And after birth, a few things might also happen. In those unhappy events, we can notice head trauma, near drowning, and infection. All those events have one common point. They cause damages to the brain in a very sensitive period. And that's precisely the difference between an adult who survived head trauma and a person who's having cerebral palsy. In one case, we are talking about an adult who lost his cerebral capacity. In the second one, we are dealing with a person who never had them. And depending on where the damages are located in the brain, we are going to have different types of cerebral palsy. And that's going to be the topic of our next video, where you're going to have the chance to have 3 awesome patients to show you the differences between their type of cerebral palsy. Stay tuned, see you next time.